Hello and thank you for joining us. My name is JoAnn Fakhouri from Juju's Exclusives, and we're here to talk today with Dr. Amjad SAFVI.
Thank you, JoAnn, for coming.
So, can you give us a little background of your profession and your involvement in the medical industry?
Sure. Well, JoAnn, we have a cosmetic center that focuses on treating liposuction and some of the other cosmetic procedures that go along with that, including the face and other places that we treat. In terms of liposuction, we have an in-house or in-the-office liposuction procedure that the patient comes in for. They're awake. We treat all sorts of areas in the body, including from chin to knees. Most common areas are abdomen and flanks and thighs and buttocks. So we treat those, and we have an active practice in liposuction, including laser liposuction and ultrasound-guided liposuction. And after each treatment, we put a compression garment, which is absolutely necessary.
Right, so compression garments are something that is standard protocol following any type of liposuction or cosmetic procedure for the body.
Correct. So the garment is put on immediately after the procedure is done to prevent swelling, also to prevent bruising, and to make the patient feel much more comfortable. Because we put a lot of fluid into the body after liposuction, and it's already swollen, so we need to bring that swelling down with a compression garment. So the patient is put into compression garments for approximately 4 to 5 to 6 weeks continuously. So this is a garment that has to do its job. It has to be sturdy, it has to be strong, it has to compress the body, and the patient has to like it.
Right, so how do you feel about some physicians who feel that once they've completed their procedure on them, to let them just go out and put themselves in maybe a Spanx or something that's so thin? How do you feel about that?
All right, the Spanx is not a good option because it's not going to provide enough compression. You've got to provide that compression to treat that areas that have been treated. You've got to keep those compressed, because the fat that tends to shift a little bit, and what you're trying to do, the compression garment, is shape the body into the area into the shape that you want it, and you have to have good compression. You may get some undulations or some lumps if you don't wear the proper compression, so it's very important. The spandex is not going to provide enough compression, so you have to have medical grade compression garments, especially Elsa's Curves garments provide probably the best compression that's out there, and it's very comfortable.
Thank you. And speaking of Elsa's Curves garments, so we have 2 of them, and this is our what we call the short. And what would you generally use this type of garment for?
Right. So the short length garment is used to treat the abdomen. So if we treat the patient in the abdomen area, including the flanks and sometimes the back, including going up to the bra line, which is where the bra strap usually is. So this garment would be perfect for those patients, and it's very comfortable. It would treat the back and the front all together.
Mm-hmm. And it comes high enough? Do you feel the length of the back is high enough for the little rolls that women tend to have?
Yeah, so especially the back. I haven't seen this feature in other garments, so especially in this garment, the Elsa's garment, this back does come up higher to treat the back, especially the bra strap lines, and those are important areas for women to get treated, and we want those areas compressed, and this does the job.
Mm-hmm. And then the ease of a zip and hook.
Yeah, this is also a very good feature. A lot of garments just give you the hooks. In this case, we have hooks and the zipper, so it produces double strength lock, so it doesn't come apart as easily. The hooks are protected by the zipper.
Mm-hmm. And the comfort level of actually putting it on, because most people are either in a lot of pain or they're not just feeling well enough to put it on.
Right, especially the pain aspect is when you're done when you've done the treatment immediately afterwards, you're numb, but then eventually you're going to wear off the numbing medicine, so you're going to get some pain, so you have to have a comfortable garment. So the zipper and the hooks make you feel much more comfortable.
Mm-hmm. And the overall feel of the garment itself from the inside and the outside?
Yeah, it's very soft. It feels very soft to the touch. It feels soft to the skin. People like it because it's smooth. And it's like wearing your regular smooth clothes.
Mm-hmm. Mm-hmm. Yeah. And then the other garment we have is the long, and that reaches up above the knee. And what would you use this garment for?
Right. So this is a longer garment that goes from the bra line to just above the knees. So in patients that have gotten their knees, not knees, but their thighs treated, lateral thighs or inner thighs, or even the buttock area, and sometimes they can get the treatment of the abdomen at the same time. If that's the procedure you had, then you would need this treatment or this garment. Or if you just had the thighs treated, then you would need this garment for that.
Mm-hmm. So there's long-term benefits and there's short-term benefits to compression garments.
Right. I think this is a very appealing garment in the sense that, first of all, it's very comfortable. It looks great under the clothes, and patients like it because it's smooth and almost silky. You can wear it after you're done wearing it after 6 weeks. You can continue to wear it as part of your routine wear just to feel better. It makes you look better if you continuously wear it. So there's nothing wrong with wearing it long term, but I think it has a great utility after the treatment. We really need to have the patient wear it for the 4 to 6 weeks, and then the patients often wear it long term after that.
Right. What do you feel about working out in this type of garment?
If you wear something compression-wise or across the abdomen, it's going to help you get a better workout, because it's like wearing for weight trainers, wearing that belt. It's just a milder compression form of that. So you're going to tighten your abdominal muscles, and you're going to get a better workout with that compression around it. It makes you feel better, and you can do more lifting or more exercise with that.
And do you feel that it holds the skin?
I think so. I mean, especially the long garment, I think that would help you go a long way, especially in your thighs and your abdomen, to do a better workout. It'll probably make you feel much better in doing the workout while you're doing the workout. So I would buy like two, one just in case you get sweaty, and then you can have to replace them. And get another one. It's very comfortable. I really think that you would get a better workout wearing this. You'll feel better.
And you look firm and tight.
Yes, that's absolutely a good benefit.
Right. Okay, great. Well, thank you so much, Dr. Safi, for taking time to talk to us about compression wear, and we look forward to talking to you again, and we'll talk to you soon. Thank you.